Back acne is quite common. It affects about 48 to 52% of people who have facial acne. It can sometimes occur without any facial lesions. Hi, I'm Dr. Achal Pant, dermatologist, and today I'm going to tell you everything about back acne. Why does it occur? What are the precautions that you need to take? And what treatment can be done at home in order to reduce the appearance of acne? So let's get started. Back acne usually affects the upper back, followed by the upper chest, then lower back, then shoulders and upper limbs. There can be variety of lesions. It can be non-inflammatory lesions, which are whiteheads or blackheads, and then there can be few red papules, to pustules, to nodules, and even cysts. So there's a huge range of lesions that we see in back acne. Back acne tends to affect men more than women. Also, the lesions tend to last longer. Acne on the face might resolve in a week, 10 days time, sometimes in 2 weeks time, but back acne tends to remain on your skin for a longer period of time, with a single lesion lasting for up to a month or taking 4 to 6 weeks to resolve. Why does it occur? The pathology is same as on the face. First is follicular hyperkeratosis, meaning that the place from which the hair comes out, there the lining is thickened, that leads to blockage of the sebum. Second is seborrhea, that is excess oil production. Third is bacterial colonization. There is increased proliferation of this bacteria called Cutibacterium acnes or Propionibacterium acnes. This tends to increase in number and in these areas, which leads to acne. And fourth is inflammation. Inflammation occurs as a result of all the three above processes, and this leads to formation of acne. Also, rise in androgen levels that occurs during puberty is thought to be the reason for increased acne in the age group of 18 to 24. So if there's any kind of hormonal imbalance, that can also lead to predisposition to develop acne on the trunk. Truncal skin is more vulnerable to external stressors such as pressure, friction, sweating, oils, occlusion as compared to facial skin. Okay, because you're wearing clothes the entire day, the shirt can rub against your back, and because of accumulation of sweat and oil in this area, these can be aggravating factors that can make your back acne worse. Why do we need to treat it? Acne on the back tends to leave behind scarring very often, and this scarring does not heal that well as compared to scarring on the face. So let's say if you get scarring on the face, you can go for a few sessions of lasers, chemical peeling, that can help in improving the appearance. But on the back, the improvement after these treatments are very minimal and not as appreciable as on facial skin. So prevention is the best way, and we have to put all our effort and energy into preventing truncal acne so that it does not leave behind scarring. Truncal acne is also more prone to develop hypertrophic scars and keloid. Hypertrophic scars are these large lesions that can be seen on the back. These are raised, like usually scars are depressed, but these are raised scars. Along with keloids, keloids are these red fleshy growth that are seen on the back, on the chest, and they can become multiple and can be large in size and can become very itchy. So if you want to avoid these, you have to treat acne on time so that hypertrophic scars and keloids do not develop. So what should you do? First, get the correct diagnosis. Acne on the back can mimic two conditions. One is folliculitis and the other is acneiform eruptions. Folliculitis can be bacterial or fungal. The most common fungal folliculitis is called pityrosporum folliculitis, caused by fungi Malvasia furfur. This can appear as multiple small red papules on the back. They are usually itchy and they are monomorphic, meaning that they all look the same, and they suddenly appear and lead to a little bit of itching and irritation on the back. Acneiform eruptions can also mimic acne. Acneiform eruptions are not acne, but they look like acne. They are multiple papules that are seen over the back. They occur after taking medicines such as steroids or some anticonvulsants or medicines for tuberculosis. This can suddenly lead to a lot of eruptions on the back. Acneiform eruptions occur suddenly all at once and are more erythematous and itchy as compared to acne. So how can you treat it? First, I'll tell you some general measures that you can take in order to reduce your back acne. First is avoiding hair oil. Hair oil forms a layer on the back and that can exacerbate acne. So if you are somebody who is prone to develop back acne, then avoid hair oil. Take a bath daily. Bathing daily with lukewarm water can help in reducing the sweat and sebum buildup on the back. So this can reduce acne. But make sure that you're not taking bath with very hot water, as that can irritate the skin and may aggravate acne. Third is wash the shampoo and conditioner off your back properly. When you're shampooing your hair, the shampoo and the conditioner can form a layer on the back. This can actually aggravate your back acne by forming a layer and causing an occlusion. So after you finish shampooing and conditioning, make sure that you use ample amount of water to clean the back properly so that there is no residue of conditioner left on your back. Fourth is wear cotton clothing and avoid synthetic clothing. If you have back acne, avoid synthetic clothing because synthetic clothing leads to accumulation of sweat for a longer period of time. Change clothes immediately after working out. If you go to the gym and work out, don't come back and linger on in those clothes and waiting for sweat to dry. Okay, immediately after workout, you have to take a bath. This way, the sweat is there on your skin for a shorter period of time. This not only helps in reducing acne on the back, but also helps in reducing the chances of fungal infections. Okay, so make sure that after you work out, you immediately take a bath. Do not scrub your back. Using a loofah or scrub or harsh physical scrubs is an absolute no-no if you have back acne on the back, because this can cause irritation to the skin that can heal with inflammation and make your acne worse and take longer for your acne to heal. So you're not going to use any loofah or scrubs on your back. Also make sure that you iron the towels properly. Your towel can have a little bit of infection lingering on in the towel fabric, so that's why make sure that the towels are washed every day and ironed every day so that there is no bacterial infection that goes from the skin to the towel and vice versa. What are some of the aggravating factors? Whey protein and taking protein supplements can aggravate acne. I get a lot of patients who have just started working out in the gym and have started taking protein supplements, and they invariably come with a lot of acne on the back. So if you are somebody who has a lot of acne on the back, then you want to avoid whey protein. I'm not saying that everybody who takes whey protein will develop acne, but it is an aggravating factor. If you are somebody who has a tendency to develop acne on the face or on the back, then you want to avoid whey protein. Instead, you can take a vegan source such as pea protein, which is less likely to aggravate your acne. Vitamin B12 injections can also aggravate acne. Vitamin B12 injections usually aggravate acne on the face but can aggravate acne on the back as well. So if you are somebody who is vitamin B12 deficient and are taking injections, bear this in mind that it could aggravate your acne. Excess consumption of milk and sugar can also aggravate acne. I'm not saying completely cut these out from your diet, but if you do have a lot of acne, especially large nodular or cystic acne on your back, then you may want to cut down on the amount of milk intake. Okay, you can cut down to maybe once or twice in a week. You can replace milk with almond milk. That is a better option. But dairy products, because of the presence of hormones in it, can aggravate acne. Dairy products also tends to increase the amount of insulin-like growth factor in the body, and this stimulates the sebaceous glands to make more oil. This can aggravate acne. Also, consuming a lot of sugar can aggravate acne. Sugar also increases insulin-like growth factor in the body, which stimulates these glands to make more oil, thereby aggravating acne. So reducing on sugar and milk can really have a positive impact on your back acne. So how can you treat acne? First, we need to know when can you treat acne at home and when you need to visit a dermatologist. So you can treat acne at home if your acne is very mild, occasional, asymptomatic, and there is no scarring and no dark spots left behind after acne. You need to seek a dermatologist opinion if you have large acne, multiple acne, if you have nodules or cysts, if you have scarring on your back, or if you have family history of scarring on the back, or if you have multiple dark spots on the back, then you have to visit a dermatologist and get it treated professionally. So what treatment can you take at home in order to control acne? There are two treatment categories. First is to reduce the bacterial overgrowth. Second is to cause gentle exfoliation. So to reduce bacterial overgrowth, you can use benzoyl peroxide, and for gentle exfoliation, you can use precipitated sulfur, salicylic acid, or lactic acid. So my product recommendations for body wash are Pyrobar soap, Benz wash soap, and FCL B Prox 10 wash. All these body washes contain benzoyl peroxide, which is very effective in controlling acne. After you use this benzoyl peroxide wash while bathing, then you can use some sprays that contain gentle exfoliants that will help in controlling your acne. These sprays can be used once or twice in a day. These lotions contain either salicylic acid, precipitated sulfur, or lactic acid, which causes gentle exfoliation of the skin and helps in controlling your acne. What can you do if you have dark spots left behind after acne? For dark spots, you need certain agents that causes exfoliation, and also you can have certain ingredients that reduces the production of melanin in the skin. So few of my recommendations are Be Body Wise Lactic Acid Lotion, Thyroidine Lotion, and FCL Bioretinol Lotion. These can be used once or twice in a day over the entire back in order to reduce the spots. I would suggest that if you have active acne, first treat the active acne with salicylic acid or sulfur sprays, and then once the active acne is controlled, then you can go and treat your dark spots, because the salicylic acid will help in reducing the dark spots as well by causing gentle exfoliation. So once the acne is resolved, then you can go in and treat your dark spots with the lotions mentioned. So in the clinic, what all treatments are you given? The treatment depends upon the severity of acne. If you have severe acne, then we usually give you oral medicines that consist of either oral antibiotics or isotretinoin or spironolactone or even oral contraceptive pills. Okay, so the choice of treatment depends upon the type of acne, severity of acne, and whether there is any underlying hormonal imbalance or not. These medicines need to be taken for a period of at least 6 months in order to see good results. You'll be able to notice results in 1 month's time, and you have to continue this for 6 months, sometimes even up to a year in severe cases, in order to keep acne under control. So we give these oral medicines for about 6 to 8 months, then we can maintain you with lotions. But remember that back acne requires long-term treatment. It is not something that you can use once and your acne will get controlled. It is very important to remember that the results will be slightly slow, and you need to continue the treatment for a longer period of time if you want to be acne free. Other treatments that can be given in the clinic are chemical peels. We use trichloroacetic acid peel, about 15 to 20%. This helps in shedding the top layer of the skin and exposes fresher skin which is devoid of acne, and even reduces the dark spots. So chemical peels are a good option. Also, we can do IPL, intense pulse light treatment, that helps in reducing active acne. So there you go, a detailed video on back acne. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Achal MD, where I post such skin and hair related content daily. Thank you for watching.